The Tuskegee Syphilis Study, one of America's darkest medical crimes. For 40 years, hundreds of black men in America were told they were being treated. But they were not being treated. They were being watched. Their blood was taken. Their pain was recorded. Their bodies were studied. And even after doctors knew how to help them, the help was withheld. This was not a rumor, not an urban legend, not a conspiracy theory. It was real, and it became one of the most shocking medical scandals in American history. This is the story of the Tuskegee Syphilis Study, a government-backed experiment that turned human lives into data and trust into betrayal. It began in 1932 in Macon County, Alabama. At the time, the United States was deep in the Great Depression. Poverty was widespread, medical care was limited, and in the rural South, black communities had little access to proper treatment. That is where the U.S. Public Health Service launched a study. Its official goal was to observe the natural progression of untreated syphilis in black men. Even that phrase sounds cold. Observe the natural progression. But behind those words were real people. Poor black sharecroppers, laborers, fathers, husbands, sons. Many of whom had little formal education and trusted the doctors who approached them. Around 600 men were enrolled in the study. Of those, about 399 had syphilis, while the others were used as controls. But here is the first horror at the center of the story. The men were never given informed consent. They were not clearly told the true purpose of the study. Many were told they were being treated for bad blood, a vague local term used to describe several illnesses and conditions. To them, this was medical care. To the government, it was an experiment. At first, researchers claimed they wanted to study the disease over time. But the cruelty became even darker in the 1940s. Because by then, doctors had something that changed everything. Penicillin. By the mid-1940s, penicillin had become the standard, effective treatment for syphilis. At that moment, the study should have ended immediately. The men should have been informed. They should have been treated. Their families should have been protected. Instead, the study continued. And this is the part that still shocks people today. The government did not simply fail to help them. It actively made sure many of them did not receive treatment elsewhere. Researchers worked to keep participants in the study even as effective medicine existed. In some cases, local doctors were discouraged from treating the men. Draft boards were contacted to prevent some participants from getting treatment through the military. That means this was not just neglect. It was deliberate denial. To understand how disturbing this really was, you have to understand what untreated syphilis can do. Syphilis is not just an infection. Left untreated, it can silently damage the body for years, even decades. It can attack the brain, the nerves, the heart, the blood vessels. It can cause blindness, paralysis, mental deterioration, chronic pain, and eventually, death. Some of the men in the study passed the infection to their wives. Some children were born with congenital syphilis. What began as a so-called medical study did not stay contained to a chart or a clinic. It spread into homes, into marriages, into families, into generations. And still, the study continued. Year after year, decade after decade. Doctors and officials observed, recorded symptoms, collected blood, performed painful procedures. And all the while, many of the men believed they were receiving help. That may be the most devastating part of all. They were not running from doctors. They were trusting them. The study was also built on racism disguised as science. At the time, some medical officials promoted deeply racist assumptions about black bodies, black intelligence, and black morality. These false ideas were used to justify unethical treatment and to frame black men not as patients deserving care, but as subjects to be observed. That matters. Because Tuskegee was not simply a failure of medicine. It was a failure of ethics, government, and human decency, shaped by the racial hierarchy of America itself. It happened in a country where segregation was law, where black Americans were denied equal treatment in hospitals, schools, and public life, and where medical exploitation had already touched many communities long before Tuskegee became public. So how did it finally come to light? For decades, the study remained largely hidden from public outrage. Some people inside the system raised concerns, but it continued. Then came a man named Peter Buxton, a public health worker who learned about the study and was horrified by what he saw. He questioned it internally. He challenged the ethics. And when his concerns were ignored, he took the story to the press. In 1972, the truth exploded into public view after reporting by the Associated Press, especially journalist Jean Heller, helped expose the study to the nation. The reaction was immediate. Shock, anger, disbelief. People could not believe that in the modern United States, decades after the Nuremberg trials had exposed the horrors of unethical human experimentation, a federal study had allowed black men to suffer and die while treatment existed. But it was true. The study was finally shut down in 1972, not in the 1930s, not when treatment became available, not when ethical concerns were first raised. In 1972, 40 years after it began. By then, the damage had already been done. Many of the men had died. Others had suffered severe health consequences. Some wives had been infected. Some children had been born with the disease. The survivors and their families filed lawsuits, and in 1973, a settlement was reached. Years later, in 1997, President Bill Clinton formally apologized on behalf of the United States government. In that apology, he said what should have been obvious long before. What the government did was shameful, and it was wrong. But even that apology could not erase what happened, because Tuskegee did more than destroy lives. It destroyed trust. And trust, once broken by institutions, does not easily return. The legacy of Tuskegee still matters today. For many black Americans, the study became a symbol of medical betrayal. That distrust did not come from nowhere. It came from history, from evidence, from lived experience. And that is why Tuskegee is not just a story about the past. It is a warning about what happens when science loses its ethics, when government loses its humanity, when race shapes who is protected and who is sacrificed. And perhaps most chilling of all, the men in Tuskegee were not kidnapped into a secret lab. They were not hidden in some underground facility. They were lied to in the open, by people wearing white coats, by public officials, by a system that called itself medical care. That is what makes this story so haunting. Not just the suffering, but the calm, bureaucratic cruelty of it all. The forms, the checkups, the polite language, the official reports. And behind all of it, a decision that these men's lives were worth less than the data gathered from their pain. That is the true horror of the Tuskegee Syphilis Study. Not that it happened in secret, but that it happened in plain sight.